Listen, EXPELS World Health Organization from Africa. On 22 October at 3 a.m., my health minister bursts into my office. No knock. Face pale. Mr. President, WHO representatives are demanding immediate meeting. They have contracts. They want your signature by morning. I feel my jaw tighten. 6 hours earlier, WHO delegation arrives in Ouagadougou, uninvited, just showed up at the health ministry with briefcases full of documents, called it urgent. My health minister received them. Professional, courteous, asked questions. They gave answers that sounded rehearsed, practiced, designed to sound caring while hiding something. But what they didn't know, my health minister records every meeting with foreign organizations, every single one. Standard protocol after we caught CIA operatives last year. He plays me the recording. WHO representative, European woman, Dr. Schneider, confident voice, explaining their vaccination program, preventive health care for Burkinabe children, protecting against future disease outbreaks, partnership with our health ministry. Sounds reasonable, sounds humanitarian, sounds exactly like what they want it to sound like. Then my health minister shows me the contracts. 300 pages, dense legal language, liability clauses, sovereignty waivers, enforcement mechanisms. I start reading, my hands start shaking. Not from fear, from rage. Article 4 stops me cold, makes my blood pressure spike. The host nation agrees to indemnify WHO and all associated pharmaceutical partners against any and all liability arising from adverse reactions to administered vaccines. I read it again, then again, making sure I understand correctly. They want me to sign away our right to hold them accountable. If their vaccines kill our children, we can't sue. If they cause permanent damage, they're not responsible. If they create health disasters, that's our problem. Article 7 is worse, makes Article 4 look reasonable. The host nation agrees not to conduct independent testing of vaccine contents and to accept WHO certification as final authority on safety and efficacy. They want us to inject our children without testing what's in the syringes, without verifying their claims, without independent confirmation. Just trust them, just comply, just inject. Article 12 removes any pretense of sovereignty. The host nation agrees to mandatory vaccination of target populations with enforcement mechanisms determined by WHO technical advisors. They decide who gets injected. They determine how to enforce it. They control implementation. Our sovereignty doesn't apply to their vaccination program. I look at my health minister. Did you investigate these vaccines? Yes, Mr. President, they're experimental, not approved by FDA, not authorized by European Medicines Agency, not cleared by any major Western regulatory authority. Phase 3 trials, still testing on human populations. That's when I realized they want to use African children as test subjects. They want us to provide the human populations their trials require. I stand, walk to the window, dawn breaking over Ouagadougou. My capital, my people, my responsibility to protect them. Schedule meeting with WHO representatives 9 a.m. I'll tell them myself. 9 a.m. WHO delegation arrives at Presidential Palace. Dr. Schneider leads. 2 assistants, all European, all confident, all expecting my signature. I enter the conference room. Don't sit, don't shake hands, don't waste time on pleasantries. Get out. Dr. Schneider blinks. Confused. I'm sorry, Mr. President. Get out. Take your experimental vaccines. Take your colonial contracts. Take your medical imperialism. And get out of Burkina Faso. Immediately. Permanently. Completely. She looks at me like I've said something incomprehensible. Like African presidents don't say no to WHO. Mr. President, you don't understand. This is a humanitarian program. We're trying to help Africa. We're trying to protect your children from disease. I slide the contract across the table. Article 4. Explain it. That's standard liability protection. Explain why you need liability protection if these vaccines are safe. All medical interventions carry some risk. Explain why these vaccines aren't approved by FDA or EMA if they're so safe. They're being used under emergency authorization. Explain why the emergency is in Africa but not in Europe or America. She has no answer, no explanation, no justification, just the expectation that I would sign because African leaders always sign. I lean forward. You want to inject experimental vaccines into African children that you won't inject into European children. You want us to sign contracts that remove all your liability if those vaccines cause harm. You want us to surrender our sovereignty over our own healthcare. That's not help. That's exploitation. That's experimentation. That's medical colonialism. These vaccines are safe. They've been tested extensively. They meet all WHO standards. If they're so safe, why aren't they approved by Western regulatory authorities? If they're so effective, why aren't you using them in Europe and America first? If they meet all standards, why do you need liability protection? Silence. Complete. She has nothing. No response that doesn't confirm exactly what I'm accusing her of. You have 1 hour to leave Burkina Faso. After that, you're in violation of our sovereignty and subject to detention. They leave, rushing, angry, shocked that an African president dared to refuse. But I'm not done. Refusal isn't enough. I need to expose them. Make sure every African leader sees what they tried to force us to accept. I call my press secretary. International press conference. Today, 2 p.m. Maximum coverage. 2 hours later, I'm reviewing the contracts again, making notes, highlighting clauses, preparing to show Africa and the world exactly what WHO tried to hide. My legal advisor enters. Mr. President, if you expose these contracts publicly, WHO will retaliate. Other African nations might pressure you to reconsider. Western governments will threaten consequences. Let them. I have the documents. I have the evidence. I have the truth. That's more powerful than their threats. 2 p.m. Press conference. 60 reporters. 20 countries represented. Cameras from every major African network. Al Jazeera, BBC, CNN, RT. I walk to the podium. The contracts projected on large screens behind me. Every clause visible, every word readable. Few months ago, WHO representatives arrived in Ouagadougou, uninvited. They came with a proposal. They called it a vaccination program. They described it as preventive health care. They marketed it as protecting African children. I pause, let the cameras focus on the projected contracts. I read the documents, examined the contracts, investigated the vaccines, and I discovered the truth they were hiding. Article 4 appears on screen. Highlighted. Undeniable. The vaccines they wanted to inject into our children were experimental, not approved by FDA, not authorized by European Medicines Agency, not cleared by any major regulatory authority. Experimental vaccines in phase 3 trials, trials that required testing on human populations. I read Article 4 out loud, slowly, clearly, every word. Translation: if the vaccines kill your children, you can't sue us. If they cause permanent damage, we're not responsible. If they create health disasters, that's your problem. African journalists in the front row faces hardening, understanding exactly what this means. Article 7 appears on screen. Translation: don't test what we're injecting. Don't question what's in the syringes. Don't verify our claims. Just trust us and inject your children. Article 12 appears. Translation: we decide who gets injected. We determine enforcement methods. We control implementation. Your sovereignty doesn't apply to our vaccination program. The room is completely silent, not even typing, just stunned recognition of what they're seeing. I read these clauses. I showed them to my health minister. I consulted with my legal advisors, and I made a decision that shocked the WHO representatives who were waiting for my signature. I looked directly into the cameras. I said no. I expelled them, and now I'm exposing them. The reaction is immediate, explosive, unprecedented. African journalists stand, applauding, some crying, Western correspondents typing frantically, diplomats rushing out to contact their governments. Within 1 hour, the documents are viewed 1 million times. Within 6 hours, 10 million. Within 24 hours, 50 million people have seen the contracts WHO tried to hide. My phone starts ringing. African leaders, one after another. Mali's president, Ibrahim, we have the same contracts, same clauses, same liability waivers. WHO is expelled from Mali. Today. Niger. French pharmaceutical companies tried the same approach. All programs terminated. Chad, WHO offices closed. Personnel have 72 hours to leave. The expulsions cascade. One nation, then another, then 5, then 10. Guinea, Zimbabwe, Tanzania, Central African Republic, Sudan, Mauritania, Congo-Brazzaville, Equatorial Guinea. Within 1 week, 11 African nations have expelled WHO. Within 2 weeks, 18 nations. Within 1 month, 26 nations. But WHO issues a statement, carefully worded, deliberately misleading, predictably dishonest. WHO regrets the decision by certain African nations to suspend cooperation on vital health programs. We remain committed to supporting African health systems and protecting African populations from preventable diseases. The vaccines in question meet all WHO safety standards and have been thoroughly tested. Notice what they didn't say. They didn't deny the vaccines were experimental. They didn't deny the contracts required liability waivers. They didn't deny they were demanding sovereignty surrender. But I have the documents, I have the contracts, I have the evidence, and evidence doesn't care about their carefully worded statements. I establish a commission, investigate all WHO programs in Africa over the past 2 decades, every vaccination campaign, every health intervention, every medical program, every adverse reaction. 3 months of investigation, my team working around the clock, accessing WHO databases, interviewing affected families, documenting patterns. What we find is horrifying. Makes the contracts look merciful by comparison. Between 2010 and 2025, WHO conducted 47 emergency vaccination campaigns in African nations, campaigns targeting diseases that weren't actually causing emergencies, campaigns using vaccines not approved in Western countries, campaigns that coincided with pharmaceutical company clinical trials requiring human test subjects. Chad, WHO meningitis vaccination campaign, 700 children vaccinated with experimental vaccine, 50 developed paralysis within weeks. WHO's response claimed the paralysis was unrelated to the vaccine, blamed it on coincidental disease outbreak, provided no compensation, conducted no follow-up investigation. Just moved on to the next country. Kenya, WHO polio vaccination program, tetanus toxoid vaccine administered to women of childbearing age. Kenyan doctors discovered the vaccine contained HCG, a hormone that causes miscarriages when combined with tetanus toxoid. WHO denied it, claimed the tests were wrong, refused independent verification. But the Kenyan government tested samples from 6 different vials, all contained HCG. All were designed to cause sterility in vaccinated women. Ghana, Kenya, Malawi, WHO malaria vaccination trial. Experimental vaccine never approved in any Western country. 700,000 children injected. WHO claimed success. But independent researchers found the vaccinated children had higher overall mortality than unvaccinated children, not from malaria, from other causes. The vaccine apparently reduced malaria deaths, but increased vulnerability to other diseases. Net result, more vaccinated children died than unvaccinated children. WHO buried the findings, continued the program, expanded to more countries. COVID-19 vaccination program across Africa. Vaccines still in emergency use authorization in Western countries. Vaccines with unknown long-term effects. Vaccines that hadn't completed normal safety testing. WHO demanded African nations accept these vaccines, distribute them immediately, inject them into populations, all while Western countries were still debating whether to mandate them for their own citizens. This is the pattern. This is the history. This is the reality of WHO operations in Africa. I released the full report publicly, all 47 campaigns, all the evidence of experimental vaccines, hidden harms, and complete disregard for African lives. The international response is silence, deafening silence. Western media barely covers it. WHO doesn't respond substantively. The UN doesn't investigate. Public health organizations issue mild statements. And life goes on, as if 8,400 harmed Africans don't matter. That silence tells me everything. African lives are expendable in medical research. Western organizations can experiment on us with impunity. I make a decision that transforms my expulsion of WHO from national policy into continental movement. I announce the African Health Sovereignty Initiative, a coalition of African nations committed to ending Western control of African healthcare. 54 nations join immediately, all saying the same thing. Enough. Enough experimental vaccines. Enough liability waivers. Enough sovereignty surrender. Enough treating African children as laboratory subjects. We establish collective health protocols. If WHO tries to implement experimental programs in one of us, they're expelled from all of us. We build integrated health systems, share medical research, train doctors together, develop capabilities, create healthcare infrastructure that doesn't depend on Western approval, and most importantly, we establish African pharmaceutical production, factories that produce medicines for African needs, laboratories that test vaccines for African populations, research facilities that develop treatments for African diseases. We're building the capability to produce our own vaccines, to test our own medicines, to conduct our own medical research, to protect our own people. Without WHO, without Western pharmaceutical companies, without organizations that see us as experimental subjects. Who is panicking? Not because 54 African nations expelled them, but because those 54 nations are building alternatives. They're panicking because we're not asking for permission anymore. We're building our own capabilities, making our own decisions, protecting our own people. Let me tell you about the children who were harmed by WHO vaccination programs, because they're not just statistics, they're people, with names, with families. Amina Diallo, 7 years old, vaccinated in WHO meningitis campaign in Chad, developed paralysis 3 weeks later, can't walk anymore, can't go to school, can't play with friends. Her parents asked too for help. WHO said the paralysis was unrelated to the vaccine, provided no compensation, offered no treatment, just moved on to vaccinate more children in other countries. Fatou Mensa, 26 years old, vaccinated in WHO tetanus program in Kenya, developed complications, couldn't get pregnant, discovered the vaccine contained hormones designed to cause sterility. She wanted children, she planned a family. She trusted WHO when they said the vaccine was safe. Now she's sterile, permanently, irreversibly. WHO denied responsibility, claimed the sterilization was coincidental, refused compensation. Kwame Osei, 4 years old, vaccinated in WHO malaria trial in Ghana, developed severe illness 2 months later. Not malaria, something else, something the vaccine apparently made him vulnerable to. He died. Who recorded his death, noted it in their trial data, but classified it as unrelated to vaccine. His death didn't count against the program's success, didn't trigger investigation, didn't cause program suspension, just became a data point in a trial that WHO called successful. I met their families. I listened to their stories. I looked into the eyes of parents who trusted WHO and lost their children, and I made them a promise I intend to keep. I promised them their loved ones would not be harmed in vain, that their suffering would mean something, that the world would know what WHO did. That promise is why I expelled WHO, why I made the contracts public, why I'm exposing their medical colonialism. The WHO Director General called me yesterday, not through official channels, a private call, a quiet conversation. President Traoré, you're creating a public health crisis. African nations need WHO support. Your expulsion of our personnel endangers millions of people who depend on our programs. I said what I've been wanting to say for months, what every African leader should say. Depend on your experimental vaccines, depend on your liability-free injections, depend on your medical colonialism. That's not dependence, that's exploitation, and it's ending. The vaccines we provide are safe. They're tested. They meet international standards. If they're so safe, why do your contracts require liability waivers? If they're so tested, why aren't they approved by FDA or EMA? If they meet international standards, why are you only using them in Africa? He had no answer. Just deflection, just excuses, just the same lies they always tell. We use these vaccines in Africa because African nations face different disease burdens, because African populations need different interventions. Tailored solutions? You mean experimental treatments you can't test in Western countries because of safety regulations. You mean vaccines you can use in Africa because you assume we have weaker protections. You mean medical experiments disguised as humanitarian programs. That's not fair. Who has saved millions of African lives? I cut him off. Done listening to justifications for medical colonialism. Proven? You conducted a malaria vaccine trial that increased overall child mortality. You implemented a tetanus program that sterilized women. You ran a meningitis campaign that paralyzed children. That's not proven success. That's documented harm. Those are isolated incidents, unfortunate outcomes, rare adverse events. Isolated incidents? I have documentation of 47 vaccination campaigns with suspicious outcomes, 47 programs using experimental vaccines. That's not isolated. That's systematic. That's a pattern of using Africa as your laboratory. He tried one last approach, offering concessions, modifications, whatever I wanted in exchange for reversing the expulsion. What do you want? What would it take for you to reconsider? I understood immediately what he was offering. Changes to contracts, adjustments to programs, cosmetic modifications that wouldn't change the fundamental exploitation. I want you to understand something. I'm not expelling WHO because I'm angry. I'm doing this because you see African children as experimental subjects. Because you use African bodies to test treatments you won't approve for your own populations. I paused. Let the weight of my next words register fully. So no, there is no concession, there is no modification, there is no change that makes medical colonialism acceptable. WHO is expelled from Burkina Faso, permanently, completely, finally. He hung up without another word. But the calls kept coming. From other WHO officials, from pharmaceutical company executives, from Western government representatives, all of them with the same message: reconsider, allow WHO to return, accept their programs. And my answer was always the same: no. Because this isn't about one vaccination program. This is about establishing a principle that African children cannot be used as experimental subjects. A pharmaceutical company executive called me, said I was threatening global health security by rejecting WHO programs. I asked him why his company's experimental vaccines were only tested in Africa. Simple question, direct question. Question that cuts through all the humanitarian rhetoric and corporate social responsibility language pharmaceutical companies use to justify their African operations. Question that demands honest answer about why experimental treatments get used on African populations before Western populations. Because African disease burdens require different approaches. Standard answer, rehearsed answer, answer designed by corporate communications teams to sound scientific and compassionate while hiding the real reason. Answer that implies they're helping Africa by developing treatments for our specific diseases. Answer that sounds reasonable until you examine it closely. You mean because African lives are cheaper to risk? I said it plainly, bluntly, without diplomatic softening. Because that's the truth beneath his polished explanation. African disease burdens don't require experimental vaccines. They require proven treatments. They require adequate healthcare infrastructure. They require clean water and nutrition and basic medical care. What African disease burdens provide is justification for experimentation, excuse for using African populations as test subjects, rationalization for accepting risks with African lives that pharmaceutical companies wouldn't accept with Western lives. He hung up, didn't deny it, didn't argue, didn't defend his company's practices, didn't explain how I misunderstood, just hung up, because he knew I was right, because he couldn't defend the indefensible, because honest conversation about pharmaceutical exploitation of African populations is impossible when the exploitation is so obvious. That response told me everything, confirmed everything, proved everything I've been saying. The silence was admission. The refusal to engage was confirmation. The abrupt termination of conversation was proof. Pharmaceutical companies test experimental vaccines in Africa because African lives are cheaper to risk, because liability is lower, because oversight is weaker, because consequences for harm are minimal. Because they can. That pharmaceutical executive's response represents entire industry's attitude toward Africa. We're not partners in medical research. We're convenient test populations. We're not collaborators in vaccine development. We're experimental subjects. We're not stakeholders in healthcare advancement. We're bodies to be used. And they won't even defend it honestly. Won't admit what they're doing. Won't acknowledge the exploitation. Just hang up when confronted. Just end conversation when truth gets spoken. Just retreat when their practices get exposed. But that phone call accomplished something. It gave me perfect example to share. Perfect illustration of pharmaceutical industry's attitude. Perfect proof of what I've been warning African leaders about. Listen to me, African leaders. Listen to every president who has signed WHO contracts without reading them. Listen to every health minister who has accepted WHO programs without questioning them. I'm talking to you directly, not through diplomatic channels, not through African Union meetings, not through official communications, directly, leader to leader, president to president, one African to another. You're watching what happens when you investigate, when you examine the documents, when you demand transparency. You're watching Burkina Faso expel WHO. You're watching 53 other nations follow. You're watching continental movement building. You're watching African health sovereignty becoming real. But more importantly, you're watching what investigation reveals, what document examination exposes, what transparency demands uncover. You're watching the truth about WHO operations in Africa come to light. The experimental vaccines, the liability waivers, the sovereignty surrenders, the systematic exploitation. When you examine the documents, the contracts WHO wants you to sign, the agreements they present as standard, the terms they claim everyone accepts, when you actually read them carefully, when you analyze every clause, when you understand what you're agreeing to, you discover Article 4 requiring you to indemnify WHO against liability for vaccine harm. You discover Article 7 prohibiting independent testing of vaccine contents. You discover Article 12 demanding mandatory vaccination with WHO-controlled enforcement. You discover you're signing away sovereignty, surrendering control over your own healthcare, accepting experimental programs without adequate protection for your people, agreeing to terms that treat your citizens as test subjects. When you demand transparency, when you ask which vaccines are experimental, when you request safety data, when you inquire about adverse reactions, when you investigate WHO's history in Africa, you discover 47 experimental vaccination campaigns, you discover 8,400 documented adverse reactions, you discover programs that harmed African children, you discover systematic pattern of using Africa as pharmaceutical testing ground, you discover the truth they don't want you to know, the reality they hide behind humanitarian language, the exploitation they disguise as healthcare assistance. WHO operates in your countries right now, running vaccination programs, conducting health interventions, all of it under contracts you probably haven't read carefully. Not might operate, not could operate, operates, right now, today, in your countries, your territories, your populations. Who has offices in your capitals, personnel in your health ministries, programs in your communities, operations affecting your citizens, running vaccination programs you probably haven't investigated thoroughly, using vaccines you probably haven't tested independently, implementing protocols you probably haven't examined critically, operating under contracts you probably signed without reading every clause, conducting health interventions that might be legitimate healthcare, or might be clinical trials disguised as humanitarian programs, or might be experimental research using your populations as test subjects. You don't know, because you haven't investigated, because you trusted WHO, because you assumed their programs were safe. All of it under contracts you probably haven't read carefully, contracts with liability waivers, contracts with sovereignty surrenders, contracts with mandatory vaccination requirements, contracts that protect WHO and pharmaceutical companies while exposing your people to risk. Read the contracts, examine the vaccines, investigate the programs, demand transparency about what's being injected into your people. Read every word, every clause, every provision. Don't skim, don't accept summaries, don't trust WHO explanations. Read the actual legal language. Understand what you're agreeing to. Know what you're authorizing. Examine the vaccines WHO wants to use. Are they approved by FDA? Are they authorized by EMA? Are they cleared by major Western regulatory authorities? Or are they experimental? Are they in clinical trials? Are they being tested on your population? Investigate the programs WHO operates in your country. How long have they been running? What are the outcomes? What are the adverse reactions? What happened to people who were harmed? Did WHO provide compensation? Did WHO conduct investigations? Did WHO take responsibility? Demand transparency about what's being injected into your people. What's in the vaccines? What are the ingredients? What are the potential side effects? What are the long-term effects? What testing has been done? What safety data exists? Don't accept trust us as answer. Don't accept WHO standards as sufficient. Don't accept humanitarian program as justification. Demand actual transparency, real data, complete information. Join me. Expel WHO from your countries, terminate their contracts, close their offices, ban their operations. This isn't just about Burkina Faso anymore. This is continental movement. This is African health sovereignty. This is protecting our children from exploitation. Join it. Lead it in your countries. Make it happen in your territories. Expel WHO from your countries. Order their personnel to leave. Give them deadline. Enforce it. Don't negotiate. Don't compromise. Don't accept promises of reform. Just expel them. Immediately, completely, permanently. Terminate their contracts. Cancel agreements. Revoke authorizations. End programs. Don't honor contracts that surrender sovereignty. Don't maintain agreements that waive liability. Don't continue programs that experiment on your people. Close their offices. Shut down facilities. Revoke licenses. Remove their presence from your territory. Make it clear WHO is no longer welcome. Make it obvious African health sovereignty means something. Make it permanent. Ban their operations. Prohibit WHO vaccination programs. Prohibit WHO health interventions. Prohibit WHO access to your populations. Make it illegal for them to operate without meeting your standards. Your approval requirements. Your sovereignty protections. To every African leader watching this, they will come for your children too. Maybe not with the same vaccines, but they will come with experimental treatments, with liability waivers, with sovereignty demands. And when they come, remember this: I expelled them. They tried to force experimental vaccines on my people, and I said no. You can expel them too. You can refuse too. You can protect too. You can be sovereign too. But you have to be willing to stand alone. You have to be prepared for their pressure. You have to document everything. You have to expose them publicly. And most importantly, you have to understand that once they try to experiment on your children, you have nothing left to lose. Once they show you they see African lives as expendable for medical research, their other threats become meaningless. To the people of Africa, 3 months ago, who tried to inject experimental vaccines into your children, I stopped them. What happened next is bigger than one expulsion, bigger than one rejected contract, bigger than one leader's refusal. What happened next is a movement of African nations saying enough. We are Africa. We control our health. We protect our children. We determine our medical programs. We are Africa, not laboratory subjects, not experimental populations, not testing grounds for treatments you won't approve for your own people. We are sovereign nations with sovereign rights over our own health care. We control our health. We decide what vaccines are injected into our children. We determine what medical programs operate in our countries. We control our health, not WHO, not Western pharmaceutical companies, not organizations that see us as convenient test subjects. We protect our children from experimental vaccines, from liability-free injections, from medical programs that harm under the guise of helping. We protect our children. That's our responsibility, our duty, our right. We protect them from anyone who would use them as experimental subjects, including WHO, especially WHO. We determine our medical programs, what interventions happen in our countries, what vaccines are distributed to our populations, what safety standards are enforced in our healthcare. We determine our medical programs based on our needs, our priorities, our sovereignty, not based on Western pharmaceutical company research requirements. The age of medical colonialism is ending. The era of African health sovereignty is beginning. And no amount of WHO pressure, pharmaceutical company lobbying, or Western government threats will change what I've done. The age of medical colonialism is ending. Not might end, not will end eventually, is ending, right now, this moment. The age where African children are injected with experimental vaccines, where African women are sterilized by programs disguised as tetanus prevention, where African populations are used as test subjects for treatments not approved in Western countries. That age is ending, not because WHO is becoming more ethical, because we're becoming less tolerant, not because they're offering safer vaccines, because we're demanding proof of safety, not because they're changing voluntarily, because we're forcing change. The age of medical colonialism is ending. I'm ending it, through expulsion, through exposure, through building alternatives. The era of African health sovereignty is beginning. Not might begin, not will begin someday, is beginning, right now. The era where African nations control African healthcare, where we produce our own medicines, where we test our own vaccines, where we conduct our own research, where sovereignty over health is real, not theoretical, where control over medical programs is actual, not nominal, where protection of our children means something. That era is beginning. I'm beginning it. Through WHO expulsion, through alternative building, through pharmaceutical production, through sovereignty assertion. The era of African health sovereignty is beginning. And once begun, it spreads. Mali will expel WHO. Niger will terminate programs. Zambia will build factories. Zimbabwe will produce vaccines. The era I'm beginning will spread across Africa, will transform the continent, will end medical colonialism permanently. And no amount of WHO pressure, pharmaceutical company lobbying, or Western government threats will change what I've done. WHO pressure is real, demands to reconsider, warnings of health consequences, threats of disease outbreaks. But pressure doesn't change facts on the ground, doesn't reopen offices I closed, doesn't restart programs I terminated. WHO pressure is their problem, not mine, not leverage over me, not influence that works. Just consequence they're suffering because they built medical programs on experimentation they assumed would continue forever. Pharmaceutical company lobbying is mounting, executives calling, investors pressuring, corporations threatening. But lobbying doesn't change my position, doesn't make me accept experimental vaccines, doesn't force me to sign liability waivers. Pharmaceutical company lobbying is their desperation. Your loss of African test populations, your problem finding alternative experimental subjects. The lobbying you're conducting proves my decision was right, proves African children were being used as test subjects. Western government threats are empty, threats of consequences, warnings of retaliation, promises of punishment. The threats are empty, not because they don't mean them, because they can't implement them effectively without exposing medical colonialism. They can threaten aid cuts. I've survived aid cuts before. They can threaten sanctions. I've endured sanctions. They can threaten isolation. I've chosen isolation over subordination. Their threats are limited by reality, by exposure they're trying to avoid, by documentation I've already released. Their threats are empty, and I'm calling their bluff. WHO expulsion stands, offices stay closed, programs remain terminated. Threaten all you want, nothing changes. We are Africa. We have the sovereignty. We control the healthcare. We protect the children. We are Africa, not just Burkina Faso, not just 54 nations. Africa, the continent, 54 nations, 1.4 billion people, the youngest population on Earth. We are Africa, united in recognizing that our children deserve protection. Our health requires sovereignty. Our medical programs must serve us. We are Africa, no longer accepting experimental vaccines, no longer signing liability waivers, no longer surrendering healthcare sovereignty. We are Africa, coordinating, cooperating, acting collectively. We are Africa, and we're taking control of our health. We have the sovereignty, the fundamental right to control what happens in our territory, the basic authority to determine our own healthcare, the core power to protect our own people. We have sovereignty, not theoretical sovereignty that doesn't apply to health programs, real sovereignty that includes medical decisions, not nominal sovereignty that surrenders to WHO authority, actual sovereignty that expels organizations that experiment on us. We have the sovereignty, the right that cannot be legitimately denied, the authority that cannot be legally challenged, the power that cannot be morally opposed. We have sovereignty over our territory, over our people, over our healthcare, over our children. We control the healthcare, not WHO, not Western pharmaceutical companies, not organizations that see African populations as convenient test subjects. Us. We control what vaccines are distributed. We control what programs operate. We control what interventions happen. We control what safety standards apply. We control healthcare through sovereign authority, through national power, through protective responsibility, through parental duty. We control it from policy to implementation, from approval to distribution, from testing to injection. We control every aspect. You want to vaccinate African children? We control whether you can. You want to run health programs? We control the authorization. You want to conduct medical research? We control the permission. We control healthcare completely, absolutely, permanently. We protect the children from experimental vaccines that aren't approved in Western countries, from liability-free injections that remove accountability for harm, from medical programs that prioritize research over safety, from organizations that value pharmaceutical profits over child health. We protect the children. That's our responsibility, our duty, our commitment, our promise to every African parent who trusts us to keep their children safe. Not symbolic protection, not theoretical protection, not protection that exists in speeches but fails in practice. Real protection. The kind that stops experimental vaccines before they reach our children's bodies. The kind that expels organizations trying to use African children as test subjects. The kind that builds alternatives so we're not dependent on those who would exploit us. We protect them from anyone who would harm them, from any organization that would experiment on them, from any program that would risk them, from anyone who would harm them, including organizations claiming to help, including programs marketed as humanitarian, including initiatives disguised as healthcare but designed as medical experimentation, who came claiming they wanted to help African children, protect them from disease, improve their health outcomes, save their lives. Beautiful rhetoric, humanitarian language, carefully crafted messaging designed to make parents trust them, designed to make governments accept them, designed to make African nations surrender our children to their programs. But I read the contracts, I examined the vaccines, I investigated their history, and I discovered they wanted to harm our children, not intentionally perhaps, not maliciously maybe, but harm them nonetheless by injecting experimental treatments, by using them as test subjects, by prioritizing research over safety. From any organization that would experiment on them, who has been experimenting on African children for decades, 47 vaccination campaigns between 2010 and 2025, experimental vaccines, unapproved treatments, clinical trials disguised as humanitarian programs. Chad 2013, 700 children, experimental meningitis vaccine, 50 developed paralysis. WHO claimed coincidence, provided no compensation, conducted no investigation. Just moved to the next country with the next experimental vaccine. Kenya 2014, tetanus vaccination program. Vaccine contained HCG hormone, designed to cause sterility in women. WHO denied it until Kenyan government tested 6 vials. All contained HCG, all designed to sterilize African women without their knowledge or consent. Ghana, Kenya, Malawi 2019, 700,000 children, experimental malaria vaccine, WHO claimed success. Independent researchers found higher overall mortality in vaccinated children. The vaccine reduced malaria deaths, but increased vulnerability to other diseases. Net result, more dead children. Who buried the findings and expanded the program? That's experimentation, using African children to test treatments, accepting risks with African lives you wouldn't accept with Western lives, conducting research that would be illegal in Europe or America. That's what we're protecting our children from any program that would risk them. WHO wanted mandatory vaccination. Article 12 of their contract. Host nation agrees to mandatory vaccination of target populations with enforcement mechanisms determined by WHO technical advisors. They wanted to decide who gets injected. They wanted to determine enforcement methods. They wanted to control implementation. They wanted our children injected with experimental vaccines, whether parents consented or not. That's risk. Forcing experimental treatments, removing parental choice, surrendering sovereignty over our children's bodies to foreign organization with history of harming African children. That's the risk we're protecting against. We protect the children, fiercely, absolutely, permanently. Fiercely because the threats are real, because WHO has harmed African children before, because pharmaceutical companies see African populations as convenient test subjects, because Western regulatory agencies approve for Africa what they reject for Europe and America. The threats are real and our protection must be fierce. I expelled WHO within hours of discovering their contracts. Didn't negotiate, didn't compromise, didn't seek middle ground, just expelled them. Immediately, completely, permanently. That's fierce protection. I made their contracts public within days, exposed their liability waivers, revealed their sovereignty demands, showed their experimentation history, didn't protect their reputation, didn't maintain diplomatic courtesy, just exposed everything, That's fierce protection. I established investigation commission within weeks, documented all WHO programs in Africa over 2 decades, found 8,400 adverse reactions they claimed were unrelated to vaccines, published everything. That's fierce protection. Absolutely, because there are no exceptions, no circumstances where experimental vaccines on African children become acceptable, no situations where WHO's research priorities override our children's safety, no conditions where pharmaceutical profits matter more than African lives. Not even during disease outbreaks, not even during health emergencies, not even when WHO claims experimental vaccines are only option. Our children's safety is absolute priority. Our protection is absolute commitment. Our refusal to accept experimentation is absolute position. Who representative asked what we'd do during disease outbreaks if we expelled them? I said we'd protect our own people with our own systems under our own control. She said we lacked capability. I said we'd build capability rather than accept experimentation. That's absolute protection. Permanently, because this isn't temporary policy, isn't political decision that changes with next president, isn't dependent on current circumstances. This is permanent transformation of how Burkina Faso approaches healthcare sovereignty. I've established African Health Sovereignty Initiative. 54 nations committed to ending Western control of African healthcare, built institutional framework, created coordination mechanisms, established pharmaceutical production capability, made protection permanent through infrastructure. I've trained new generation of Burkinabe doctors, educated about medical colonialism, aware of experimentation history, committed to protecting African children, made protection permanent through education. I've built alternative systems, African vaccine production, African medical research, African pharmaceutical manufacturing, made protection permanent through capability that doesn't depend on WHO or Western companies. The protection you thought WHO provided, we provide it. The safety you believe WHO ensured, we ensure it. The health you trusted WHO to maintain, we maintain it. Who claimed they protected African children from disease, claimed their vaccination programs saved lives, claimed their interventions improved health outcomes. Many African parents believed them. Many governments trusted them. Many nations depended on them. But that protection was illusion. That safety was conditional. That health came with price of accepting experimentation. We provide real protection now, protection that doesn't require accepting experimental vaccines, protection that doesn't demand signing liability waivers, protection that doesn't surrender sovereignty. We've established African vaccine production facilities, manufacturing proven vaccines, using tested formulas, producing treatments that meet same safety standards as Western vaccines, providing protection without experimentation. We've built African medical research capabilities, studying diseases affecting African populations, developing treatments for African health challenges, conducting research with African safety standards and African ethical oversight, ensuring safety without exploitation. We've created African pharmaceutical supply chains, producing essential medicines, manufacturing antibiotics, antimalarials, antiretrovirals, ensuring health without dependency on organizations that see us as test subjects. We ensure safety that WHO claimed to ensure but actually undermined, safety from experimental vaccines, safety from liability-free injections, safety from programs that prioritize research over children's well-being. We've implemented strict vaccine approval protocols. Every vaccine used in Burkina Faso must be approved by Western regulatory authorities first, must have completed full safety testing, must have established track record, no experimental vaccines, no phase 3 trials on our children, no using African populations as test subjects. We've established independent testing requirements. Every vaccine batch gets tested by Burkinabe laboratories before distribution. We verify contents. We confirm safety. We don't just trust WHO certification, we ensure safety through our own verification. We've created adverse reaction monitoring systems. Every vaccination gets documented. Every negative outcome gets investigated. Every pattern gets analyzed. We ensure safety through systematic surveillance that WHO never provided. We maintain health that WHO claimed to maintain but actually risked. Health of children who aren't injected with experimental vaccines. Health of women who aren't sterilized by disguised programs. Health of populations who aren't used as research subjects. We've reduced child mortality through proven interventions. clean water, nutrition programs, mosquito nets, antibiotics for bacterial infections, basic health care that works without experimental vaccines. We've improved maternal health through trained midwives, prenatal care, safe delivery practices, postnatal support, health care that protects women without sterilizing them. We've controlled disease through public health measures, sanitation, hygiene education, vector control, proven methods that don't require experimental medical interventions. We protect the children better than WHO ever did, because we value African lives as much as we value any lives. WHO's protection was conditional on accepting experimental vaccines, conditional on signing liability waivers, conditional on surrendering sovereignty, conditional on treating African lives as less valuable than Western lives. Our protection is unconditional, based on principle that African children deserve same safety standards as European children, based on belief that African lives have equal value to Western lives, based on commitment to protecting our children regardless of cost or pressure, better than WHO because we don't experiment on our children. WHO conducted 47 experimental vaccination campaigns in Africa between 2010 and 2025. We conduct 0, who injected 8,400 African people with vaccines that caused adverse reactions. We inject 0 with experimental treatments. Better than WHO because we don't accept double standards. WHO uses vaccines in Africa that aren't approved in Western countries. We don't. Who accepts safety standards for African vaccines that are lower than Western standards? We don't. Who takes risks with African lives they wouldn't take with American or European lives? We don't. Better than WHO because we prioritize children's safety over research objectives. WHO's programs serve pharmaceutical company research needs. Our programs serve children's health needs. WHO's interventions generate clinical trial data. Our interventions generate healthy children. Because we value African lives as much as we value any lives. That's the fundamental difference. That's why our protection is better. That's why our safety is real. That's why our health outcomes will ultimately surpass what WHO achieved. WHO's actions revealed they value African lives less. Experimental vaccines they won't use in Europe. Safety standards lower than Western standards. Liability waivers removing accountability for harm. All proving they see African lives as less valuable, as more expendable, as acceptable losses in pursuit of research objectives. We value African lives equally. Same safety standards, same approval requirements, same liability accountability, same ethical oversight, same protection, equal value demonstrated through equal treatment. Because we won't experiment on African children any more than we'd experiment on European children. That's the test. That's the standard. That's the principle. Would we inject European children with vaccines not approved by EMA? No. Then we won't inject African children with them either. Would we use American children as test subjects for phase 3 trials? No. Then we won't use African children as test subjects either. Would we sterilize European women through disguised vaccination programs? No. Then we won't sterilize African women either. Would we accept higher mortality rates in vaccinated American children compared to unvaccinated children? No. Then we won't accept higher mortality rates in vaccinated African children either. That's equal protection, that's equal value, that's equal treatment. What's unacceptable for European or American children is unacceptable for African children. What's too risky for Western populations is too risky for African populations. What requires full safety testing in Europe requires full safety testing in Africa. Because we protect them. Not because it's easy. Not because it's convenient. Not because Western organizations approve. Because it's our responsibility, our duty, our commitment, our promise. You built your medical research on our exploitation. We just ended your research until you agree to our terms. Your medical research. The pharmaceutical industry's vaccine development. The clinical trials that generate billions in profits. The drug testing that creates new treatments. All of it built on exploiting African populations. Clinical trials that require human test subjects, thousands of people to inject with experimental treatments, populations to monitor for adverse reactions, data to analyze for efficacy and safety. Human test subjects you can't recruit in sufficient numbers in Western countries because Western people understand the risks and refuse to participate. Vaccine development that needs population testing. Phase 3 trials requiring tens of thousands of participants. Real-world effectiveness studies needing hundreds of thousands of people. Long-term safety monitoring demanding millions of person-years of data. Population testing you can't conduct in Western countries because regulatory requirements are too strict and liability risks are too high. Drug trials that demand real-world data. How do experimental treatments perform in actual populations? What are the side effects in diverse genetic backgrounds? What are the long-term consequences of new medical interventions? Real-world data you can't generate in Western countries because ethical oversight prevents experimentation on vulnerable populations. Your research that you can't conduct in Western countries because of safety regulations. FDA requires extensive animal testing before human trials. EMA demands rigorous safety data before approval. Western regulatory agencies enforce strict ethical standards. Standards that make experimenting on Western populations difficult, expensive, and legally risky. That you can't implement in Europe because of ethical standards. European ethics committees require genuine informed consent. European regulations protect research subjects from exploitation. European oversight prevents pharmaceutical companies from prioritizing profit over safety. Standards that make European populations unavailable for the kind of research you want to conduct. Your research that requires populations with supposedly weaker protections. Populations in countries with less strict regulatory oversight. Populations in nations with fewer resources to verify vaccine contents. Populations in regions where pharmaceutical companies can operate with less accountability. Populations you can experiment on without facing consequences for harm. That's where Africa came in. That's why WHO wanted access to our children. That's why pharmaceutical companies partnered with WHO for African vaccination programs. Because Africa provided the populations with supposedly weaker protections. You built your medical research on African populations, on our children as test subjects, on our people as experimental groups, on our bodies as research material. 47 WHO vaccination campaigns in Africa between 2010 and 2025. How many were actually clinical trials disguised as humanitarian programs? How many were phase 3 testing for vaccines not yet approved in Western countries? How many were gathering data pharmaceutical companies needed for regulatory approval? Won't answer those questions, won't disclose which programs were research versus treatment, won't reveal which pharmaceutical companies were funding which campaigns, won't admit how much of their African operations were actually clinical trials. But the patterns reveal the truth. Experimental vaccines used in Africa years before Western approval. Vaccination campaigns coinciding with pharmaceutical company trial timelines. Adverse reactions documented but dismissed as unrelated. All indicating systematic use of African populations for medical research. On our children as test subjects, 700 children in Chad injected with experimental meningitis vaccine. 700,000 children in Ghana, Kenya, and Malawi injected with experimental malaria vaccine. Millions of African children injected with vaccines still in clinical trials. All test subjects, all generating data, all serving pharmaceutical research objectives. On our people as experimental groups. Kenyan women injected with tetanus vaccine containing sterilization hormones. Populations across Africa receiving vaccines with unknown long-term effects. Communities used to test drug interactions and effectiveness in diverse genetic backgrounds, all experimental groups, all providing data pharmaceutical companies needed. On our bodies as research material, African genetic diversity useful for understanding vaccine effectiveness across populations, African disease burden providing natural experiment conditions, African healthcare systems weak enough that pharmaceutical companies could conduct research without rigorous oversight. Our bodies as research material generating billions in pharmaceutical profits. Your medical research built on our exploitation. On informed consent that isn't truly informed. On voluntary participation that's coerced through aid conditioning. Informed consent requires understanding. Understanding the risks. Understanding the experimental nature of treatment. Understanding the alternatives, understanding the right to refuse. But WHO's consent processes didn't provide genuine understanding. Parents told vaccines were safe and proven, not told they were experimental, not told they weren't approved in Western countries, not told about adverse reactions in previous trials, not told they were participating in clinical research. That's not informed consent, that's deception. Informed consent requires freedom. freedom to refuse without consequences, freedom to choose alternatives, freedom from coercion or pressure. But WHO's programs didn't provide genuine freedom. Countries told accepting vaccination programs was conditioned for other aid. Communities told refusing vaccines meant losing healthcare access. Parents told not vaccinating children meant being denied services. That's not freedom. That's coercion. Voluntary participation requires choice, real choice, meaningful choice, choice without penalty for refusing. But WHO's programs didn't provide genuine choice. Mandatory vaccination requirements. Article 12 of their contracts. Host nation agrees to mandatory vaccination of target populations. That's not voluntary, that's forced. That's removing choice entirely. Aid conditioning. Accept our vaccination programs or lose development assistance. Implement our health interventions or face funding cuts. That's not voluntary, that's economic coercion. On safety standards that are lower than Western standards. Vaccines used in Africa that aren't approved by FDA or EMA. Testing requirements less rigorous than Western requirements. Adverse reaction thresholds higher than Western thresholds. Double standards proving African lives are valued less. On liability protections that remove accountability for harm. Article 4 of WHO contracts. Host nation agrees to indemnify WHO and all associated pharmaceutical partners against any and all liability. Translation: if vaccines harm African children, pharmaceutical companies face no consequences. No lawsuits, no compensation, no accountability, liability protection they wouldn't get for Western populations. On regulatory oversight that's weaker than Western oversight. African regulatory agencies under-resourced. African governments lacking technical capability to verify vaccine contents. African oversight systems unable to monitor long-term safety. Weak oversight enabling experimentation that stronger oversight would prevent. Your research that harms African children in ways you wouldn't accept for European children. 50 children paralyzed in Chad. WHO claimed unrelated to vaccine. Would they claim that if 50 European children were paralyzed? No. Investigation would be immediate. Program would be suspended. Compensation would be provided. Women sterilized in Kenya. WHO denied responsibility. Would they deny responsibility if European women were sterilized? No. Scandal would be enormous. Legal consequences would be severe. Accountability would be demanded. Higher mortality in vaccinated children in Ghana, Kenya, Malawi. WHO buried the findings. Would they bury findings of higher mortality in vaccinated European children? No. Program would be terminated immediately. Research would be investigated thoroughly. Those responsible would face consequences. That takes risks with African lives you wouldn't take with American lives. Experimental vaccines on African children that wouldn't be used on American children. Safety standards for African programs lower than standards for American programs. Adverse reaction rates acceptable for African populations that wouldn't be acceptable for American populations. We just ended your research. Not gradually, not eventually. Now, today, this moment. We ended it by expelling WHO, by terminating programs, by closing facilities, by banning experimental vaccines. Expelled WHO from Burkina Faso, ordered personnel to leave, closed offices, terminated all programs, immediate expulsion, complete expulsion, permanent expulsion, no WHO operations, no WHO programs, no WHO access to our children. That expulsion ended their research access, ended their ability to conduct trials in Burkina Faso, ended their programs using our children as test subjects, ended immediately, ended completely, ended permanently. Inspired 53 other African nations to expel WHO, Mali, Niger, Chad, Tanzania, Kenya, Zimbabwe, Ethiopia, across the continent, coordinated expulsions, systematic termination of WHO programs, continental rejection of medical colonialism. That continental expulsion ended pharmaceutical industry's access to African test populations, ended their ability to conduct clinical trials disguised as humanitarian programs, ended their exploitation of African children for research purposes. We ended your medical research by removing access to African test populations. The children you were injecting with experimental vaccines, no longer available. 847 million children in Africa, previously accessible for WHO vaccination programs, previously available as test subjects for pharmaceutical research, previously exploitable because African governments accepted WHO programs, now inaccessible, now unavailable, now protected, because 54 African nations expelled WHO, because we're building our own healthcare systems, because we're producing our own vaccines, because we're protecting our own children. The women you were sterilizing through disguised programs, no longer accessible. Millions of African women of childbearing age, previously targeted by WHO tetanus programs, previously vulnerable to sterilization vaccines, previously exploited because oversight was weak and accountability was absent, now protected, now monitored, now safe, because we test every vaccine batch, because we verify contents independently, because we don't trust WHO certification, because we ensure safety through our own systems. The populations you were using as research subjects, no longer exploitable, 1.4 billion Africans, previously treated as research material, previously used as experimental groups, previously exploited for pharmaceutical profits, now sovereign, now protected, now controlling our own healthcare. We ended your medical research, not because we oppose medical advancement, because we oppose experimentation on African bodies. Medical advancement is important. Vaccine development saves lives. Drug research creates treatments. Medical science improves health outcomes. We support medical advancement, but not through exploiting African populations, not through using our children as test subjects, not through accepting lower safety standards for African lives, not through experimentation that treats us as less valuable than Western populations, not because we reject vaccine development, because we demand equal safety standards. Vaccines are valuable medical tools. Vaccination programs have eliminated diseases. Immunization protects populations. We support vaccine development, but not through double standards, not through using vaccines in Africa that aren't approved in Europe, not through accepting risks with African children you wouldn't accept with European children, not through development that exploits us. Not because we want to harm global health, because we refuse to be harmed for pharmaceutical profits. Global health is important. Disease control benefits everyone. International cooperation improves outcomes. We support global health, but not through our exploitation, not through our harm, not through treating African lives as expendable for global benefit, not through health initiatives that profit pharmaceutical companies while harming African children. We ended your medical research until you agree to our terms, until you agree to our terms, not your terms, our terms. Your terms were exploitation, experimental vaccines on African children, liability waivers removing accountability, lower safety standards than Western standards, sovereignty surrender over healthcare decisions, terms that treated African lives as less valuable. Our terms are equality, same safety standards for African vaccines as Western vaccines, same approval requirements, same testing protocols, same regulatory oversight, same ethical standards, equal treatment demonstrating equal value. Terms that protect African children as much as European children. No experimental vaccines on African children unless same vaccines are being used on European children. No phase 3 trials in Africa unless same trials are happening in Europe. No accepting risks with African lives you wouldn't accept with European lives. Terms that apply the same safety standards to African vaccines as American vaccines. FDA approval required before use in Africa. EMA authorization required. Full safety testing completed. Long-term effects studied. Same standards, equal protection. Terms that provide the same liability accountability for African harm as Western harm. No liability waivers. Full accountability for adverse reactions. Compensation for harm. Legal consequences for negligence. Same accountability. Equal justice. Terms that ensure the same informed consent for African participation as European participation. Complete disclosure of experimental nature. Full explanation of risks. Genuine freedom to refuse. No coercion through aid conditioning. Same consent standards. Equal respect. Our terms. Terms that treat African lives as equal to Western lives. Terms that respect African sovereignty over African healthcare. Equal treatment. Equal standards. Equal protection. Equal accountability. Equal consent. Equal respect. That's what our terms demand. That's what equality requires. That's what African lives deserve. Respect for sovereignty. African nations control African healthcare. We decide what vaccines are used. We determine what programs operate. We establish what standards apply. We control our own health systems. Sovereignty respected. Authority acknowledged. Control maintained. You agree to them, or your research stays ended. You accept them, or your clinical trials stay suspended. You recognize them, or your vaccine development stays blocked. Choice is yours. Accept equal treatment. Accept equal standards. Accept equal accountability. Accept African sovereignty. Then research can resume. Then trials can proceed. Then development can continue. Or refuse. Maintain double standards. Continue treating African lives as less valuable. Keep demanding sovereignty surrender. Then research stays ended. Trials stay suspended. Development stays blocked. Access to African populations stays terminated. Your choice. But the terms aren't negotiable. The standards aren't flexible. The equality isn't optional. Accept our terms or lose access to African populations. Simple. Clear. Final. I am Ibrahim Traoré, President of Burkina Faso. WHO tried to inject experimental vaccines into African children. I expelled them. Not some minor president they can ignore, not some compliant leader they can pressure, not some subordinate they can threaten. I am the president who rejected IMF loans, who moved gold reserves beyond Western control, who blocked NATO corridors, who defied every Western expectation. I am Ibrahim Traoré, the African leader who keeps refusing what we're supposed to accept, who keeps protecting when we're supposed to comply, who keeps building sovereignty when we're supposed to maintain dependence. And I just expelled WHO from Africa, president of Burkina Faso, small country, limited resources, tiny healthcare budget, nation most Westerners can't locate on a map, but president of the country that's protecting African children. That's inspiring resistance to medical colonialism. That's demonstrating health sovereignty. That's proving alternatives exist. President of Burkina Faso, small nation, big impact, limited resources, unlimited determination, tiny budget, enormous influence. And from this small country, I'm ending control of African healthcare. Who tried to inject experimental vaccines into African children? Vaccines not approved by FDA. Vaccines not authorized by EMA. Vaccines not cleared by any major Western regulatory authority. Experimental vaccines in clinical trials. Trials requiring human test subjects. Subjects they couldn't recruit in Western countries. Subjects they wanted to find in Africa. Who tried to inject these experimental vaccines into African children, into our sons and daughters, into our future, into our most precious resource? They tried, with contracts requiring liability waivers, with demands for sovereignty surrender, with pressure for mandatory implementation. They tried to inject experimental vaccines into African children. I expelled them, not negotiated better terms, not discussed improved safeguards, not requested additional protections. I expelled them, ordered WHO personnel out of Burkina Faso, closed WHO offices, terminated WHO programs, banned WHO operations. I expelled them, immediately, completely, permanently. Not because I'm anti-vaccine, because I'm pro-African children, not because I oppose public health, because I oppose medical experimentation, not because I reject international cooperation, because I reject colonial exploitation. I expelled them, and then I exposed them, released the contracts, published the documents, showed the world what they tried to hide, and what happened next shocked them more than they could have imagined. 54 nations joined me, expelled WHO from their territories, terminated WHO programs, closed WHO facilities, united in protecting African children from experimental vaccines. What happened next was continental awakening, recognition that WHO sees African children as test subjects, understanding that their programs prioritize research over safety. What happened next was movement building, nations coordinating health sovereignty, leaders sharing documentation, governments building alternatives, populations demanding protection. What happened next shocked them, because they thought I'd be isolated. They assumed other leaders would comply. They believed African nations would maintain WHO programs. They were wrong, completely wrong, catastrophically wrong. What happened next was the beginning of the end of WHO control over African healthcare. The age of medical experimentation on African populations is ending. The era of African health sovereignty is beginning. And no amount of WHO pressure, pharmaceutical lobbying, or Western threats will change what I've done. We are Africa. We expel WHO. We protect our children. We control our healthcare. We build our sovereignty. And we will never surrender that sovereignty again. Not to WHO, not to pharmaceutical companies, not to Western governments, not to anyone, because we've seen what they tried to do. And we stopped them. And now we're building something they can't control. An Africa that protects its own children. An Africa that conducts its own medical research. An Africa that produces its own vaccines. An Africa that determines its own health programs. An Africa that is truly, completely, permanently sovereign over its own healthcare. They tried to experiment on us. We expelled them. And Africa is protected.